My name is Michelle Bombi. I'm 56 years old. I live in Holland, Michigan, and I'm a theater professor where I teach costume design and different design classes, and I'm chair of the theater department at Hope College in Holland, Michigan. My husband and I have 3 children, 1 girl and 2 boys that are all grown and off pursuing their own lives. I was taking a birth control pill that was continual, and my doctor informed me that I probably might not know when I was experiencing my first signs of menopause because the small amount of estrogen in the birth control pill would probably mask those symptoms. So it was about 3 years ago. I was on a trip and forgot to bring my birth control pills with me and got slammed pretty hard with my first hot flashes. And they were not just at night, they were during the day, they were constant, they were continual. It was miserable. I don't think I experienced many other symptoms that first 6 months or so. I started taking some medication for the hot flashes that was herbal, that was not an estrogen pill or anything. So those subsided to manageable, and it was about a year into that when I first started experiencing pain in intercourse. I thought something was perhaps wrong with me, that I might have an infection, that something might be going on. So at first I was just quiet about it. I didn't talk to anybody. I didn't even tell my husband about it. This was different. This was a very different kind of pain that was really unbearable. And so I would just start avoiding having any kind of intimacy at all because I didn't want to have sex because the pain was so bad. And after a few weeks, it wasn't going away, and I was pretty convinced I didn't have a bladder infection or something else going on. So I thought, I'm going to have to talk to my doctor about this. When I met with Dr. Dupree and explained what was happening and that I was experiencing pain during intercourse, she let me know that I had a variety of different options to try. One of the conditions for me that I wanted to avoid was taking hormones. That wasn't something that I had taken previously for my menopausal treatment, so I didn't want to start now. So I was glad to hear that there were options out there for me that weren't involving taking hormones. The other issue for me is that I wasn't interested in applying a cream or something topically. When I first started experiencing pain in intercourse and I spoke to my husband about it, we thought perhaps it was just a dryness issue, so we tried different lubricants. Nothing was really changing, so we just were not having sex for a while. We waited for my doctor appointment to talk and see if there might be something else that we could try. So it clearly was more than a lubrication problem. And so she told me about a product called Osphena that would be orally taken, a pill that I could take every day and it not have to worry about interrupting my sexual life to put something on that felt false to me. So this was something that could be part of my daily routine that I could just take every morning. So Dr. Dupree prescribed Osphena for me and I started taking it. And after the first 3 or 4 weeks, I started seeing marked improvement.
When discussing treatment options for painful sex and/or vaginal dryness, ask your doctor if Osphena is right for you. You can also find more information at osphena.com.
Important safety information, including boxed warning and indication. Indication. What is Osphena? Osphena is a prescription oral pill that treats moderate to severe painful intercourse, moderate to severe vaginal dryness, symptoms of changes in and around your vagina due to menopause. Most important information you should know about Osphena. Warning: endometrial cancer and cardiovascular disorders. Osphena works like estrogen in the lining of the uterus, endometrium, but can work differently in other parts of the body. Taking estrogen alone, or Osphena, may increase your chance for getting cancer of the lining of the uterus. Vaginal bleeding after menopause may be a warning sign of cancer of the lining of the uterus. Your healthcare provider should check any unusual vaginal bleeding to find out the cause, so tell him or her right away if this happens while you are using Osphena. Osphena may increase your chances of having a stroke or blood clots. You and your healthcare provider should talk regularly about whether you still need treatment with Osphena. Call your healthcare provider right away if you have unusual vaginal bleeding, changes in vision or speech, sudden new severe headaches, and pains in your chest or legs, with or without shortness of breath, weakness, and fatigue. Who should not take Osphena? Osphena should not be used if you have unusual vaginal bleeding, have or have had certain types of cancers, including cancer of the breast or uterus, have or have had blood clots, had a stroke or heart attack, have severe liver problems, are allergic to Osphena or any of its ingredients, or think you may be pregnant. Tell your healthcare provider if you are going to have surgery or will be on bed rest. Possible side effects. Serious but less common side effects can include stroke, blood clots, cancer of the lining of the uterus. Less serious but common side effects include hot flushes or flashes, vaginal discharge, muscle spasms, headache, excessive sweating, hyperhidrosis, heavy vaginal bleeding, vaginal hemorrhage, night sweats. Tell your healthcare provider about all of the medicines and supplements you take, as some medicines may affect how Osphena works. Osphena may also affect how other medicines work. Duchenet USA encourages you to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For full important safety information, please see prescribing information, including boxed warning and patient information.